Hello, my name is Alan Lumsden. I'm here today with Dr. William Brown, who joined us from Beaumont Hospital, where he's the Chief of Vascular Surgery. He gave a talk for community surgeons last night on legislative aspects of healthcare, and today talked about what do we need to know about medical malpractice. So thank you. I've already been stopped multiple times in the corridor saying how great your presentation was.
Well, I appreciate the invitation. It's certainly an honor to be here at Methodist Hospital.
So Bill, when and why did you decide to get a law degree?
I was in medical practice. I was practicing vascular surgery, and there were always things about the law that I found very interesting. Not just medical malpractice, but such things as constitutional law. I was a philosophy major in college, so constitutional law held a lot of interest for me. And as I've always said, law school is sort of wasted on law students. As an adult and being in practice, I was very interested in tax law, and I was very interested in property and real estate. So there was a whole fund of knowledge that was open for me, and that's why I decided to pursue it.
So, one of the things that we always talk about, part of a Pumps and Pipes conference that we run, is the other guy's toolkit. And it seems to me like that's really what you've done. Most of us think about other medical specialties, but you've kind of reached into a completely different specialty and said, what are the pieces of information that I can use and apply? How do you use this in your practice on a daily basis? I mean, I know you're a practicing vascular surgeon, but so how does the legal background impact what you're doing?
It actually impacts it in many ways. Number one, from the obvious standpoints of taking care of patients and making sure that I've documented things and I've pursued things correctly. But it also helps me deal with people and trying to understand. One thing about the law is you're always trying to think about the other person's agenda. What are they thinking about? What's concerning them? And so again, as a physician, we usually are thinking about our own agendas. We're not thinking about what the other person's thinking about. We're trying to push our own agenda. Whereas in the law, it's important to understand, okay, what's that other person thinking, and how am I going to reach a medium? How are we going to reach a point where we can, a consensus, where we can agree about something? So it happens with hospital administration, which can be challenging at times. It happens with patients' families. And so again, I think that it's helped me do that. It's also helped me, to be quite candid, not respond as surgeons. Our response to dealing with problems are, give me a knife. As a lawyer, you take a step back and you go, okay, I'm going to calm down and I'm going to go through step by step by step. And so that's where I think it's sort of helped me, again, reevaluate some of my responses to situations.
So do you think it enables you to, let's say, take on bigger, badder cases, or does it intimidate you? You have so much background knowledge, you read about medical malpractice, one could think that you may be paralyzed into not doing things. And so has it broadened what you feel like you're capable of doing surgically, or has it limited it?
I don't think it's limited it. I think that it has perhaps enhanced it somewhat, in the sense that I now feel confident to approach patients and know that I have done everything I possibly can do to make sure they are clearly informed about what I'm doing, why I'm doing it, and how I'm going to do it. I guess, ironically enough, is I'm establishing a record. Physicians, unfortunately, tend to just pursue ahead and charge ahead. They seriously and carefully think about decisions, but then they charge forward, and they may not share those with the people who are also involved. Whereas I've become much more attuned to sharing my thought processes with other physicians and patients that are involved in the procedures.
How long have you been at Beaumont?
I've been at Beaumont for 34 years.
So tell us about Beaumont and compare it with Methodist, for example, what you know about us.
They're really quite similar. As we've discussed, they really are quite similar. Beaumont is a large community hospital, providing excellent care for the suburban Detroit and metropolitan Detroit area. We have a full range of specialties. We are a tertiary referral center. We are a level 1 trauma center. We have now an associated medical school. but for many, many years, we did not have a medical school. We were just focused upon clinical care and providing excellent community care. We've now sort of expanded that into the medical school, and we're focusing a little bit more on education. We always had residency programs, but we did not have medical students. And as you well know, having dealt with medical students, that's a whole nother dimension in terms of providing medical education.
So for how long did you have no medical school affiliation?
We had a affiliation with Wayne State University, but it was a relatively soft affiliation. They rotated students out there, but we really did not have a strong input into the university. We've had, I think, medical students now at Royal Oak, I think 5 years as our school has been open. I believe it's 5 years. And it has changed the culture of the institution. Physicians are now focusing more on educational aspects. As you know, in a private practice, your focus is getting the work done. And you try to do some teaching, but it may be difficult. We now are focusing more on, again, providing outstanding clinical care, but in the same vein, providing education.
So the medical school is a different organization with an affiliation agreement. They don't all roll up to one master, for example.
They do not. They do not. There is the hospital and the medical school, and they are, they have chosen to be separately connected, I guess is the best way to say it.
And how long is that relationship?
I think it's been about 5 years.
Okay.
Yeah.
Good? Challenges?
I think that it has been excellent. There are some significant challenges with having a new medical school. There is as you well know, having been in both academic and private practice situations, there are different mentalities that we try to deal with, and focusing on clinical care as opposed to education. Do you want to be a university as opposed to a private practice hospital? Can be challenging, can be difficult, but we're working through that.
So let's talk about you. What's next for Bill Brown?
You know, I'm not sure. I still enjoy doing what I do. When it's no longer fun or I physically can't do it, I'll stop doing it. I will continue to practice law. And I don't know in exactly what aspect. I may teach at a law school. I always enjoyed teaching. I have taught law school for many years in the past, and I enjoy teaching law students. They're very different than medical students.
So what are the law students' response? If you gave that lecture that you gave today, which is probably, you can interpret it as being pro-physician, supportive of physician, you change it when you go talk to the law students?
Ironically, I don't change it very much. The truth is this, they understand. I may change some of the phraseology, as you can understand, but basically I don't change it very much. Law students, it's very interesting. Law students are very ideologic. When they come into law school, and I'll give you a quick example. I always ask the law students the first day, I say, well, you know, what if you want to file a case, and you have a patient who comes in or a client, and they want to file a lawsuit, and you say to them, okay, and they've had these terrible damages, and so you say, okay, and I'm going to go out and I'm going to see if I can get an expert. So you go out and you get a really acclaimed expert, and the expert said this is not malpractice, and so as an attorney you go, well, okay. Let me see if I can find somebody else. And they go find another guy who's still board certified, and that one says, there's not malpractice here. This is not negligence. So now they're a little more disappointed because they had this terrific injury. And I say, and then they are told, you know what? Somebody tells them at lunch, go ask this doctor over here and see what he thinks. I'll bet you'll be happy with the response. So now you go over and you ask a third doctor, and he says, oh yeah, that's malpractice. Now the guy may not have a very good reputation, but now he'll testify it's malpractice. And I asked him, do you file the lawsuit? Mm-hmm. The law students, almost to a person, say, no, it would be unethical to file a lawsuit. If you ask a practicing attorney, he'll tell you absolutely, in a minute. So it's again, they're very ideologic. And then I guess as they go through, as medical students are to some extent, you're very ideologic when you start out, but then you learn the practicalities of the real world. So I think that, trying to keep, just for us too, trying to keep some of that ideology as we travel through is probably a good thing.
Bill, thank you. You bring tremendous expertise and a different kind of view of the world from almost anybody else that I know in the cardiovascular space. So
I
thank you
appreciate
again
it.
for coming.
Thank you
Enjoyed
very
it.
much.
Yeah.
I appreciate it.